Welcome back. Now, in the past 3 years, over almost 3,000 children under the age of 5 have died of malnutrition in hospitals in South Africa. These numbers have been revealed to the National Assembly by the Department of Health. Many families hit hard by the COVID-19 pandemic and poverty are battling to put food on the table. To discuss this further, we are joined by Save the Children South Africa, Gugu. Thank you so much for your time, Gugu. We do appreciate it. This is very alarming and very concerning. And maybe if you have any insight as to how bad the situation is, and is it really over or almost over 3,000 in the last 3 years?
Thank you very much to you and the listeners. Save the Children agrees, and chances are the numbers that we are seeing right now are less than what it really is, because as mentioned, the children that you have that have died have been in hospitals. There are some that did not get to the hospitals. So yes, we do have a malnutrition problem, and government is doing a lot about it, but there's a lot that still needs to be done with our communities, because for us to be able to deal with malnutrition, let me give one example. By 2015, we had about 60%.
So, Gugu, sorry, I'm going to interrupt you. I'm not sure if it's your hand over the speaker, but we're struggling to hear you. Can we just test with you again to see if we can hear you?
Can you hear me now?
It's not great, but let's try. Just continue with your answer.
Yes, I was mentioning the fact that 32% of women in South Africa are exclusively breastfeeding, and that is one of the best ways of managing malnutrition. And if we have such a low number of women that are exclusively breastfeeding, then we do have a problem, and we are going to see malnutrition becoming a problem in children.
With these alarming malnutrition rates and deaths that we are seeing, could it be said that a lot of these children are prone to other diseases as well, and that could possibly be the reason that could lead to their deaths?
Yes. Remember, as soon as the child's immune system is not strong because they are not eating well, then it's easy for them to get other infections. And infections like TB, like HIV, other upper respiratory tract infections, including COVID, which is a problem right now. So then it then makes the children to be more vulnerable, and it's easy for them to be sick and to die out of malnutrition.
So the numbers are very alarming, and I'm confused and concerned at how we are allowing this to get so bad in the last 3 years. Yes, of course, COVID-19 did not help the situation, but you know, as organizations Save the Children and in collaboration with governments, if there is any at all, is there no effort to try and stop this from happening? I mean, one child is just too many.
Yes, definitely, I agree with you. And the government, as I said earlier, is doing a lot about it, including other non-governmental organizations that are in the country. I think the best place to start is the fact that government is providing social grants, and it's known that where social grants are provided and they are used for the food of children, you are able to at least reduce the vulnerability. And then the other thing that I think is important is that parents need to breastfeed, which I think is very, very important. And then parents that decide to use formula milk, it becomes a problem because they end up trying to economize, and yet the child is not getting sufficient nutrition. So thus we say it's best then to have the child be on the breast milk, and then let's provide complementary feeds that are appropriate. So there's need for parents to be educated on what kind of food that must be given to children. And then children that go to early childhood development centers are better off because most of the early childhood development centers are subsidized, and so they do get nutritious food, and they're provided even by other organizations. So you do have a chance of that child not escaping malnutrition. But very important is what the child is given in the home setting.
Certainly. And then, Gugu, just lastly, are there any provinces that are hardest hit or harder hit than other provinces? And what should, families, mothers, those who don't have much and are struggling, and the prediction is it's going to get worse because South Africans are just not coping with how everything is just increasing and everything's becoming so much more expensive. Maybe provinces that are a red flag and of concern, and what people should be doing to try and stop this?
Okay. Right now we know that KZN, Eastern Cape, Gauteng are the 3 top provinces in terms of malnutrition in children. And now KZN is even more vulnerable because you've got a large number of people that have lost their homes because of the floods 4 weeks ago and the floods yesterday, which means KZN's problem is even bigger. So what is happening right now is that many organizations are providing food parcels and food vouchers for parents to be able to have food. And so it means we are going to prioritize parents that have children and say the children is already supporting KZN. So that's where we are going to start. And then we are also going to make sure that the people in KZN specifically and Eastern Cape need to be able to be exposed to, one, children must be immunized because that's another thing that weakens the immune system of children. And also, we need to assess women and children. What are the food needs and how can we support them to provide the immediate food that is needed so that we can be able to curb malnutrition. And then we also need to make sure that clinics are assessing children early so that we can pick up malnutrition and treat it whilst it's still early.
Certainly, it's a very worrying picture, but thank you for all your efforts and all you're doing to try and stop this malnutrition. It's a very worrying picture. That was Save the Children, South Africa's Gugu Xaba.